it's very important to have other interests outside of medicine. And medicine is not your entire life, and it's not the definition of who you are, for one thing. You are a bunch of different things to a bunch of different people, as well as to yourself. And you obviously have things that you probably loved as a child, and I think those are kind of reflective of things that maybe need to be carried on with us throughout our whole life. For me, my art has really become something that I make a lot of space for. I give it priority, and that's because I finally recognize that I really do need it in my life.
Hello, everyone. Welcome back to the channel, or welcome to the channel if you're new here. We have a lovely guest in front of us today. We have Dr. Laura Tafe. Dr. Tafe is a molecular thoracic and GYN pathologist, an artist, a lover of mountains and big sky, and I am delighted for her to share her story and her love of art with you today. But before we do that, Laura, welcome to the channel.
Thank you so much, Jillian. It's really a pleasure to be here. It's so nice to have connected with you, and thanks for inviting me.
I love that we connected too. So for people who are skeptical of social media, I find that when you have shared values, the AI sometimes works in our favor and connects people that are meant to be connected.
That's right. I agree. I've seen it happen several times, so I'm a believer of that as well. Yeah.
And so as an introvert that I know you mentioned that you are, and a pathologist who sometimes doesn't get to talk with a whole lot of people during the day, I would love for you to introduce yourself and share your story.
Oh, okay. I'll do my best. As an introvert, I don't particularly love talking about myself either. Yeah. So as you said, my work is as a pathologist. So I work as a molecular pathologist, a thoracic and GYN pathologist. So about half of my time is doing diagnostics for GYN and thoracic neoplasms. And part of that is teaching residents. And about the other half of my time is in the molecular diagnostics world, which is bringing up new assays, validations, as well as finding out molecular findings. And a lot of that can be, I focus a lot on the solid tumor side of things. So we do a lot of testing for targeted therapy and personalized medicine to see if a tumor harbors a mutation that can be targeted with a particular therapy. So that's kind of my day job. Who else am I? I am I'm also a mother, and I have two children. And as you said, I'm also an artist, which I've brought into my life a few years ago. It's always kind of been a part of my life, but really has become an emphasis in the last couple of years. So I have started to talk a little bit more about art, and kind of that connection between art and medicine, I think is really fascinating and something I've been exploring a little bit more.
Yeah, I can't wait to dive in to that part. But for people who haven't yet maybe decided, maybe if there's med students watching or people who are thinking about going into medicine, can you tell us what drew you to pathology?
Sure. I tend to be a very visual person, and pathology, I think, is a very visual field, particularly the anatomic pathology side of things, because we are using microscopes to look at tissue and make diagnosis based on histologic findings. And I think pathologists play an incredibly important role in the care of patients. So we are a little bit behind the scenes, which is a bit unfortunate. However, we are very key into the patient management, because we are really the ones who are making the diagnosis that patients are subsequently treatment is based on. And so that's very important. And I think we have a lot of opportunities to do more education about what we do as pathologists. Med students are more than welcome to come and rotate with us here if you're part of our institution. And there's quite a lot of activity on Twitter, for instance, with pathology and pathology education. So many of us are very friendly people and would love to tell you more about what we do in our day-to-day life. So
It's interesting. I think Dr. Glocken had this video about pathologists being the friendly ones, like, oh, come on over. And And it's fantastic. Like you said, I work in head and neck cancer, and often in tumor boards, the pathologists are there explaining
Yeah.
what they saw and how they diagnosed what they diagnosed.
Absolutely. Yeah. Going to tumor boards, that kind of multidisciplinary context is a lot of what we do and have a lot of those conversations. And that's a really great form of education and also being part of the team of patient care. So I enjoy
Awesome.
that part very much, interacting with other colleagues who are also treating our patients.
I love it. And I was mentioning to you when we first spoke, we were talking about art, and I was like, yeah, it's interesting how quickly we give up the things that are quote unquote optional. And you gave me some feedback on art, and I would love for you to share how you perceive your art now.
Sure. I think what I said is that for me, art is a priority and it's not a hobby. And that's a really important distinction for me because I think of hobbies as being something that, people do for fun and they have this optional component to them. But for me, my art has really become something that I make a lot of space for. I give it priority, and that's because I finally recognize that I really do need it in my life. It's almost a compulsion that I need to be able to create and express myself that way. So that I do make that distinction that it's just kind of part of who I am, part of my life at this particular point. It's not something I see as I pick it up here and there as being optional. So I have really kind of shifted some priorities over the last few years to make space for it. And I think that's what it comes down to kind of figure out some of those things that you truly value, as you mentioned about values as we started this conversation, kind of figuring out what those things are for you, what you want more of in your life, what you want less of in your life, and kind of creating that life that you want with the resources you have, and making that space for yourself.
And for as much as you feel comfortable in sharing, what were you experiencing? Like, what were the thoughts that led you to be like, this can no longer be optional for me?
Yeah, so that's a much longer story, I think. Kind of a cumulative story throughout, I think, my entire training, particularly through medical training. So I did a lot of art as a kid, and really up through probably college, I did tons of art. And then from college on, it was something that I really did put aside. And at some point, I definitely felt the pressure of needing to choose kind of between the two. I kind of have this conscious memory around college age of thinking that it wasn't either or. I think now I really would have appreciated if someone had said, no, it's an and. You don't have to do one or the other. It's an and. You can form a life by doing both of those. So at that time, I did put aside art, and I would come back to it periodically throughout the years, take art classes here and there, do some projects for myself and so on, but it wasn't taking up a lot of space in my life. And of course, I was also going through medical school and residency and fellowship, and I had two small children during training as well. So I didn't have much personal time, let alone personal space to do my art. And I found, early in my career to be a little bit of a challenge in terms of being in academia and feeling a lot of pressures to kind of meet the requirements or the desires of academic medicine. And so that was a little bit challenging for me. My partner is not in medicine at all, so I think there was a little bit of him not necessarily understanding how different medical life is from otherwise civilian life, I guess you would say, in a way. So there were, some challenges for me personally. I also lost my mother in 2014, very suddenly and unexpectedly, and that really kind of, it sent me through a lot of grief and depression. And several years later, I finally was kind of at a point where I was feeling very overextended in my work life, and not very feeling like I was feeling fulfilled. A little bit of I was missing something. And that was kind of the point where I finally started to pick up my art and do it with intention and with a lot more prioritization. At that point, my children were also a little bit older, so they didn't need me quite as hands-on as much, and I was able to create some more space for myself in terms of making that a real priority that I do several times a week right now. It took me a while to get there, and I certainly do wish that I had people earlier on that had been able to model for me that you can have a life of both elements and how to do that well. So.
And I'm so sorry to hear about your mom.
Yeah, thank you.
You know how oftentimes we don't allow ourselves to process grief? We're actually told to hold it in and
Yeah.
just keep going.
Right.
Yeah, I know
Right.
that. I know that very well as well. And the importance of letting it out in whatever way works
Mhm.
for you. So for the people who need to hear the message that you needed to hear at several points in your career earlier, what would that message be?
I think it would really be that it's very important to have other interests outside of medicine, and medicine is not your entire life, and it's not the definition of who you are. For one thing, that you are a bunch of different things to a bunch of different people as well as to yourself, and you obviously have things that you probably loved as a child, and I think those are kind of reflective of things that maybe need to be carried on with us throughout our whole life. But those are things that bring us joy and we can have passion and pleasure from, and make us feel balanced and more rounded. I think medical training is is very pathway driven, and I think, you've obviously been through it, so maybe you've experienced that to some extent too, that there's not a lot of discussion about other parts of ourselves, and some of that is just that, there's so much pressure to be learning so much at once and performing at a high level. So I would have appreciated someone who could have said, or at least just asked the question of, like, what else do you like to do, and what brings you joy, and what things would you like to have more of, and sharing what those things were for them too. So I think it needs to be modeled, how to do that in order for it to feel like it's acceptable to talk about. I think
I
that's
would love to highlight that comment because for me, when I left, I was started my career in oral surgery. I stayed in it for 3 years while having suicidal thoughts regularly because I
wow.
didn't have an identity shaped outside. I was in the military. So when you said civilian life, I'm like, that's how I think about military civilian life, medicine civilian life.
Right,
It's a
right.
different world. But
It is.
I love the message you're sharing because it helps us to not feel trapped, with the mental distress. We know the increased risk for suicide, just this moral distress. And when we put too much of our identity and our worth within our career, it can heighten the risk for catastrophic events.
Absolutely.
Um,
Yeah.
and so absolutely when we are shaping the I am a person who, and even without the attachment to a medical degree or title, say like I'm a person who takes care of patients, and that person
Mhm.
resists leaving clinic or leaving the pathology lab, or and leaving your career because you're afraid to let go of I take care of patients. But if we can translate that to how you take care of people, like all people are patients, and you
Yeah.
can still be a very caring person, and actually maybe even more so if it's not under this restrictive confines.
I totally agree with that, and I think, and I'm very sorry you had that experience that brought you to that point, and I'm glad you're out of it and
Thank you. Yeah, thank you.
and found a way out. And I think another thing about my art, it does feel like it's taking care of myself, and I think it's, like you said, it's taking care of those other parts of myself that are outside of this definition of me as a physician. And it's definitely grown my confidence in different ways, and really kind of brought new connections and new opportunities into my life that have been totally unexpected, and quite frankly very delightful. And so it's been a really neat adventure in that regard.
I love when we hear things going towards the side of delightful in medicine, right?
Right, right. We definitely need more of that. Yeah.
So tell us more about your art.
Yeah. So I think Well, most of my art right now is collage out of paper, and I'm a very tactile person as well, so I use physical paper as opposed to making digital collages. So it's analog collage, and I have been a paper person all my life. When I was a small child, I used to carry around a box of paper rather than a stuffy. I would carry around a box of paper. So a weird child at that point. So I think it was some foreshadowing in my love of paper and leading me to collage. I do quite a lot of collage. I also do a little bit of watercolor. I have been mixing the two at some points as well. And a lot of it is very spontaneous, very intuitive. I work usually in the evenings when my brain is kind of tired and has kind of shut down. So a lot of it is not very verbal or not really necessarily planned out. It's more responding to images and stimuli and other thoughts that have kind of accrued over time, and reactions to things that are going on in my life or that I'm feeling at that particular moment. Being a physician, I sometimes am asked, do you do medical art? And I really don't do medical art, and I'm not saying I won't, because I am interested in that, but it's not my personal practice right now to do medical-based art. It really has originated of just being a form of expression for myself, and if I don't do it for a few days, I crave it, and I like, okay, time for me to disappear and go make something. So that's kind of my art practice, and that's where I am with it right now.
Oh, I love that. And it's nice to be spontaneous. That's such like the opposite of this linear restrictive pathway.
Right, exactly. It's very freeing, and feels, yeah, very creative, and just one thing sparks another thing, which sparks another thing, and you just kind of keep going along and just responding to things very intuitively. It's lovely, actually.
It's you can tell from your expression, right? And the way it just feels relaxed when you're talking about it.
Yeah. But I have to say, it wasn't always easy to talk about it or to share it. It really took me a long time to even be able to use the word artist for myself. I think, there's a little bit of how do you define yourself as an artist, and when do you feel like you're an artist? And I guess eventually at one point I decided I make art and I make it for myself, and so I'm an artist. So
I love that. I'm a runner. The same thing happens for runners. Like,
oh yeah,
how are we going to call ourselves a runner? Well, I run, and therefore I'm a runner, right? Like
right,
people, if
right.
they start judging themselves based off of how far they run, why they
Hmm.
run.
Right.
So, can you repeat? What makes you an artist?
What makes me an artist is that I make art and I make it for myself, and I decided that was enough for me to be an artist. So
I
yeah.
love it. I love it. Yeah,
Yeah.
and you said your art brings you new opportunities and connections. Can you discuss more
Hmm.
of that?
Sure. I started to share my art. I had a couple of people on social media that were good friends who supported me, and that kind of gave me the confidence to start sharing in that kind of more public context. And then some people locally as well. So I started sharing on social media, and locally there's a really nice art gallery that has occasional calls for art for group shows, and so I've submitted some pieces and been part of their group shows, which has been a lot of fun to be doing something locally. And then yeah, and then a lot of it is online, and sharing like on Twitter and so on. And the surprising things that have happened have been multiple things. Such as meeting you, I think is
Yeah.
one thing. And then there's been many other instances that are kind of similar of kind of crossing paths with people with similar interests, and meeting people who are also artists, not necessarily connected to medicine. I've also been invited to participate in a book on art and medicine, which is called Artistry Making Medicine. It came out last year, in 23, and so that was just something that happened because I shared my art and someone saw it and asked me if I would be interested in participating in that book. And so I've also been people have reached out to me to be part of a women's artist group. So a women's physician artist group, I should specify. So there's a few of us who meet about monthly and talk about art. And we're in medicine, so some people do medical art, some people don't, but we're there to support each other and kind of talk about the benefits and the challenges of being a physician artist. And let's see, a lot of friendships I think have kind of blossomed out of sharing this as well. So yeah, a lot of different things. And also locally too, I submitted some art to, like, the medical students have a literary journal, so I submitted some art to that, and then that brought me in touch with some of the medical students, and now I'm an advisor for their literary journal and meeting some people in the hospital too who also have this art and medicine and humanities and medicine interest. So it's kind of opened up the doors to a whole other world of people and opportunities and ways of thinking and thinking about art and healthcare too. So I like that.
It's so amazing to have what, like, you're painting the picture from the artist, painting the picture for me of all of these communities. We know that loneliness is an epidemic in our world right now.
Yeah.
And a lot of the feedback I get when I do coaching or am involved in groups that have coaches that are leading these groups, and a lot of it's like, I'm siloed, I feel lonely, I feel misunderstood. And you being who you truly are and expressing yourself in an authentic way has connected you to the people that are like a community. I anticipate, does it feel like a good sense of
It does.
belonging?
Yeah, it absolutely does. And there's definitely people I've built relationships with that I care about and I'm inspired by, and feel like I can, reach out to them potentially if needed. Or in the pathology world, when I go to an annual meeting, for instance, I have met people that I met online and haven't met here, and then have other conversations besides pathology conversations. So that's been really nice too. So yes, I do think it has been a way to build community in a different way. And I'm really, having experienced that myself, I'm really curious about kind of trying to open up those parts of other people to hear, my colleagues, my neighbors right around me, like what are some of those things that are interesting for them, and engage in those conversations and kind of, hopefully they'll start expressing some of that a little bit more to me too.
I love that you're doing that. And I'll share that during med school, I tried to go back to acting. I loved acting,
Oh,
my form of
fantastic.
expression. So I went to acting. I actually recently reconnected with my acting teacher from that time. What I found was that I was in such a state of depression and exhaustion that my capacity to be creative was stunted.
Mhm. Yeah.
I felt like I was empty inside.
Yeah.
And I started judging that. Rather, she's like, just
Yeah.
keep showing up, just read the lines, like, just, she was trying to meet me where I was at, but I had set this bar so high and I couldn't reach it
Yeah.
that I
Yeah.
quit. And that was one of the things I regret, because I was on a medical leave. So I had the time,
Mhm.
and didn't allow myself to just get into it as much as I could, and be, with the energy that I had then, to allow myself to kind of expand. But it's mind boggling how limited our expression can be after we've been holding it
Yes.
in and
Yeah.
in survival mode.
Oh, absolutely. I've been there with depression, and I know how dark it can feel, how uncreative you can feel, and your energy is totally absorbed. And I would say, don't be too hard on yourself. Understand where you were and why you made that decision, and it doesn't mean you can't try it again. So I would say, don't regret it. You learn from it, and give yourself another opportunity to do it. And maybe you get a little bit of that from doing this YouTube channel. I
Yeah.
don't know.
Yeah, and making the thumbnails. I realized that, like, people always ask, why haven't I outsourced my editing and thumbnails? I'm like, because I actually love it.
Yeah,
I
then you
love
should be doing it. Right.
Yeah, I
Right.
love to
Yeah.
re-listen to it, because when we're talking, sometimes we miss some things, like, oh wow, I
Right.
love to hear it again and to capture those key moments. And it's another opportunity to spend time with you when you're gone. And then, like, I
Right.
try to create the thumbnail that captures the person's personality, or, with if you had art like that you gave me or showed me what you did, try to capture what you caught in your art, like the colors and like the design that you like and everything. I
Yeah, yeah.
personalize it.
No, that's awesome.
Yeah, well, it takes me a lot longer, but oh well. But
But you
that's
get pleasure out of it when it's something that's for you and it feels creative, it feels, inspiring, and you're happy doing it, then it's worthwhile. It doesn't matter what time it takes. It's worth taking the time to do it. So
yeah. And I was
yeah.
just talking to a therapist today, and during about like the bouts of depression, I was like, yeah, I was noticing what I was trying to take off of I was feeling overwhelmed. And
Mhm.
I was noticing what I was trying to cut out of my schedule was all the things that I like doing.
Right.
But
Right.
my conversation with you earlier this week made me not chop those things up, because I'm like,
Yay.
no, those are non-negotiables. Those are my
Mhm.
priorities. And I'm going
Right.
to set the boundaries in this other soul sucking endeavor, which is not going to be sustainable long term. And
Yeah.
it's, I think when we're used to working 110%, well, I'm going to give myself permission to work the 100% and to reduce those things that I'm doing for free, or maybe work
Yeah.
85%. But that's, in residency, I was told that like my lower percent, maybe 50%, was some people's 100%, as much as like high
Right.
achieving people. Not to say that that's measuring anyone's worth based off of the feedback I was provided, but productivity level wise, if you're a
Right.
high achiever, you can probably get a lot more done that
Right.
society values. And then give yourself permission to set that other percentage for yourself.
Yep. Yep. Yeah. Well, good. I'm proud of you for doing that.
Well, it's a huge thank you to you.
Yeah. Oh, wow, that's awesome.
Yeah, and it aligns. I would actually feel like sometimes it comes across. So this whole channel and my mission is to help people to really lean into what's true to themselves, and to
Mhm.
learn to prioritize ourselves first, and how
Right.
easy it is to mentally, like, yeah, it makes sense. I got to put my oxygen mask on first.
Right.
But there's so
Right.
much behaviorally that we have to unlearn and rewire in order to really put that into action and apply it. Because I find I get a lot of guilt if I'm trying to put myself first, and then reduce the guilt, I go and do the overwork
Do
thing
the
again. I'm like,
overwork. Yeah. Yeah.
oh,
Yeah. Yeah. It is very hard. It's hard to find that, and I think the values thing is key. I think that kind of helps determine what your priorities are, and then from your priorities, you choose which things you want to do or work on. And it is hard with the kind of the expectations of academics to say no to things, as well as really set those boundaries as to this is my time, this is work time, and so kind of taking for me kind of taking a step back and asking myself, do I really want to do that? has made a difference, and then I can not just respond yes because I should be doing it. It's more like, yeah, this would feel good, I would enjoy doing it, it feels along kind of where my purpose is headed and that sort of stuff. So you will get there because awareness is a huge part of it, and
mm-hmm.
I'm completely still working on it. So I just try to be a little bit more aware every time.
Yes.
Yeah.
And I'm reading books. I'm reading a book called Reviving Ophelia right now,
Oh,
at a recommendation of one of our physician coaching
yeah.
friends. But it talks about, the things that we have normalized in our culture, right? Like oppression of women, and why do we
Right.
become people pleasers, and why even in medicine, regardless of gender identity, it's this people pleasing. If I don't say yes to this, I don't look like a team player. If
Mhm.
I'm not on
Mhm.
this committee, a lot of times people are concerned about their promotions. If I
Right.
don't do all these publications, even though maybe, they're not totally enthused about submitting science, even. I was, on Twitter, there's a lot of conversations about expectations for med students to have all these publications.
Yeah.
And I personally find that it's diluting science, because then you have quantity over quality. And if you
Correct.
push people to research things they're not interested in, their long
Yeah.
term desire to do research is actually likely going to be a lot lower.
Oh yeah, they're gonna burn out very fast. Yeah. That's it's not sustainable whatsoever, and it's a bad precedent to set, I think. Um,
And there was one person on Twitter, a med student, that was given the advice to make sure whatever was offered to her, she said yes to. So
oh.
let's go back to this message that you just said. So if, it's hard as a med student because your grades are dependent on how you appear.
Right, right.
So
And your evaluations and all that sort of stuff. Yeah. It is hard as a med student. But yeah, I think I think the change has to go both ways. I think people at attending level need to be working on changing that side of the culture, and med students, I think, need to be realizing that they have, some autonomy and agency about shaping their present in what they're doing. Because I certainly felt as a med student, I just pretty much did what I was told because I thought I had to do it to get done with the rotation, without necessarily thinking that this is not, this is not serving me well at this particular moment in time. And it's a very hard position, I think, to be in, particularly early in your career. But I think if you're not thinking that you have some power, then you're setting yourself up to just perpetuating that kind of cycle.
yeah, and unfortunately, sometimes so I'm a fellow right now, and I am observing and thinking about the times where that lack of feeling like you had power or autonomy was kind of valid, right? It's like,
Yeah.
do I have autonomy over this or not? What are the consequences either way? So
Mm-hmm.
we'll step it up into attendinghood where maybe we've learned things and the culture of the institutions is all going to be different. But as you said, academia is kind of a similar beast in all different institutions. So if you were given a committee, for example, to be on, but you knew that this is not going to align, what could it look like if, say, Dr. Tafe, would you like to be on this committee? What could the assessment even be like if you were trying to identify if
Um,
it would be something
I,
you wanted to?
yeah, I think for me, I would first say, let me think about it. If I think it's always wise to take a little pause before committing one way or the other. I usually let it stew a little bit for myself, and if I'm not strongly feeling, yeah, I absolutely want to do this. If it's like I should do this, I don't know. It's a no. It really needs to be a no. And and I'm also have had enough experiences at this point to know that there will always be something else. If you say no to one opportunity, there will always be other opportunities, and you might be surprised where they come from. And it might be something you want to do way more than that thing that you were ho hum about. But if you commit to the ho hum thing, by the time that other thing comes, you're not going to have the capacity to do it, or you won't have, the time and mental space to do it as well as you would like to. So I think it's kind of learning how to fine tune that judgment in yourself of, are you absolutely enthusiastic about doing this, or is this something you feel like you should be doing? I think the should be off
Stop
off
shitting
the
on
option
yourself,
block.
right?
Yeah,
Stop
stop
shitting
shitting
on yourself.
yourself. Exactly.
Yeah. There's Dr. Jimmy Turner. He's an anesthesiologist in North Carolina, and he's got a book, and I reread it. It's like, I think chapter 12 in his book is like the hell yes factor. I
Yep.
don't know if that's what it's really called, but what the chapter, I don't know if that's not the right chapter. This is in his book. It may not be chapter 12, but it could be. Anyways, that's besides the point. The point is, he was talking about the thermometer to use when you're looking to say yes or no to an
Yeah.
opportunity. It
Yeah.
aligns with what you said. If it's not hell yes, it's hell no. And sometimes it can come from a place of privilege and not always be, don't always have the capacity. I've had to say
That's true.
okay to some things, but if
Yep.
you are given the autonomy to say yes or no, and as you displayed, if it's not a hell yes, and if you say yes to this, what are you saying no to? That could be so much better.
Yeah.
And
Yeah.
even identifying somebody that, like, what, that opportunity could actually serve this person so much better.
Yeah, I think that's a brilliant place to be at, is to try to um, help that network grow. Also, yeah, help support people that would be fantastic in that particular role. If it's not going to serve you, it might serve someone else. That's that's part of mentoring. That's part of kind of getting to the place where you have the right to say no to things, and it's very welcome to share with someone else other opportunities. I think that becomes almost a responsibility of ours to start, pushing things to other people at a certain point too. But that's a fantastic idea, and yes, I agree with doing that.
And for the med students who are, they're currently looking at the landscape and they're feeling a little disillusioned and disheartened by their future, what are some words of advice to maybe increase their optimism and hope that they can, carve a path as you have to really keep themselves a priority?
Um, well, I try to say something along those lines to the med students. I teach the first year med students when they are like about 6 weeks into their classes. So I do have an opportunity at that point to say a few words along those lines. I usually show them some of my art and tell them how I kind of got back to my art and why that's important to me, and to remind them that they they have those things that they love too, that are outside of medicine, and that it only really enriches themselves and their lives. I think medical schools are starting to see some of the benefits of bringing these other aspects into medical training. There are more like humanities and arts types programs as part of the curriculum for medical students I'm seeing across the country. So I think having people that are willing to stand up and say that this is important for them, and to remind them that they have the right and the responsibility to themselves in order to choose these things that they want to continue to carry forward, and to support each other. We get in situations when we're in training that we give up going to someone's wedding, or someone's graduation or something like that, because we feel like we can't ask for coverage or help from others, and we really have to be better at giving each other help in those sorts of situations, to support each other, because we all have those things that happen in our lives that are important, that are outside of our training life, and we need to help each other through that. So I think those are some of the things I would say. I
Yeah.
think
Yeah.
I think there is a lot of interest and movement towards changing medicine right now. I feel like that momentum has picked up, and I'm hearing it from different places. So it is happening. It's going to be a little bit of a slow process, but every generation has an opportunity to do things a little bit differently, and people are verbalizing things that they don't think are right anymore, or that are pointing out disparities that they think should be righted, and people are working to change it. So I think there is a lot of hope for that. um, Healthcare is a very challenging place to be for many reasons, but I think if we maintain kind of some of those integral things to what make us humans and connect to each other, then those are strengths that keep carrying us forward.
I love that. It's one of my missions is to bring the humans back into the healing, and for everybody, not just if we don't feel like humans, it's really hard to help the patients feel like
Right.
humans.
Yeah.
And we're all
Yeah.
patients at some level.
Certainly. Or we all will be at one point. Yeah.
Yeah, I liked
Yeah.
seeing our institution was just recruiting for a chief wellness officer, and the wellness officer isn't in charge of like creating yoga or self-care events. This chief wellness officer is really a change agent at the systemic level, like
That's
flow
awesome.
optimization, personal development, um, and the self-care is part of it. It's just trying to reduce the blame on the individuals that are part of the system
Absolutely. Yeah.
for what they're going through.
Yeah.
And when you were saying about bringing the art back into, or bringing the art into medicine, I was thinking about how in elementary school, like when the funding is low, they chop off PE. Or if somebody has difficulty, like I used to get in trouble a lot because I was goofy. I got told to stay in from PE, from recess. As like, you have this person that got in trouble because they're kind of hyperactive, probably a little
Yeah.
bit bored,
Right.
and you keep them in. and I would do science experiments, so it worked out fine. But it was like you just this restlessness, and we're actually taking away the things that would be the most healing for these
Yeah.
people, like what they truly need.
Yeah, and I think right after PE is art and music that are cut in
Yeah,
schools. Yeah, yeah,
unbelievable.
exactly, exactly. It is unbelievable. But,
So you said you share your art online. So I know a lot
hmm
of us are going to be like, well, where do we go to find it? Can you help us out?
um, actually, Twitter is probably the best place to go and find it. I do post at least once a month. I post a few things, so there is a record of my stuff on there. I do use like a little hashtag to mark some of them, which is LJT Analog Collage, which is in my bio. So you can click on that and find some of my prior work. So thank you.
Yeah, sure. Well, I will share your Twitter handle down below because I know that's how we connected. Is that the best
Yeah.
place for them to connect with you?
Yes, that'd be great. Yeah. I'm there frequently, so that is a good place to connect with me.
You shared incredible amounts of takeaways and life lessons, but in case you had some other things you want to make sure that we share with the audience, what would be some takeaways from today's discussion?
I think one other thing I wanted to mention that probably I've kind of alluded to is that we all have the agency to make choices and small changes in our lives, and even very small things can have very big effects on ourselves and on kind of the people that we touch. And so, don't lose track that you have that power, and you can really. It's very easy to kind of get overwhelmed of everything that's happening in the world or that's happening at your institution and so on. But you can do very small things for yourself and for others that I think really do have a big impact. And I think just remembering that you're you're a multi person. You have multiple parts to you, and that's really important to hold on to. Yeah,
One of my friends said multi-passionate.
yeah, I
I
love that.
I love it. I definitely, but she's an artist, physician, artist,
Uh-huh.
pathologist, actually. She
Oh
no
wow.
longer practices pathology, but she practiced pathology. And then I met her because I did a life coach training through Martha Beck's program, and she was a facilitator. And she was vivacious, she's very artistic in what she was wearing and in her background. And I was like, oh my God, this woman's like full of color. I just gotta,
That's
whatever she's
awesome.
taking, I need it. And yeah, so maybe that's somebody I need to connect you with. She'll be coming to a book event, sharing her book called Swimming with Elephants, which is about her
Oh,
journey from pathology to shamanic healer, life
oh wow.
coach. So I'll
Yeah, I'd
invite
love
you.
to I'd love to learn more about her.
Yeah, February 5th, book event. I will share the event information if you want to come, if other
Sure.
people want to come.
Thanks. Thank you.
But yes, it has been such a pleasure talking with you today,
That's a
Laura. I
pleasure
really
for you.
appreciate it.
I appreciate it too. I thank you for the lovely conversation and for reaching out to me.
Yep. And I can't wait to hear for the artists that are coming up to the surface here and they're excited to connect with you. So make sure to point out who you are down below. And
All
until
right.
next time.